Welcome back, everyone, to the Pelvic Pulse podcast. I'm really excited about this episode. We have Vienna Farlow with us, and she is maybe better known as the consultant. And let's just say it the way you say it.
You've got to hit it. You have to hit that T, that consultant.
Consultant. Yes, yes. Your
That's why it's
vagina's
there.
consultant. Exactly, exactly. Maybe you
Exactly.
start with that, the reclamation of that word, even. How did you did that just come out of your mouth one day, or what was the story?
Basically, yeah. I mean, so it's the consultant, vagina consultant. And it was just kind of it was honestly a joke. I have I have a sense of humor and it can be a little bit dark and it can be a little snarky and it can be a little dirty. And I just honestly thought it was hilarious. I wanted to be like a menstruation consultant. And then I was like, ooh, but what if I was a menstruation consultant? And then what if I was just a consultant? And I think, yeah, it's like one of it. Yeah, I like saying it for lots of different reasons. I remember being like, I don't know, in eighth grade or something and learning that it was like the worst word you could say. Like some girl in the locker room was like, never someone said that to me. I would just like lose my mind and being like, okay, wow, okay, crazy. Um, Good to know. And
Right.
then, sometime shortly thereafter, my mom had this book. It's called the Book of Women's Myths and Secrets. Wait, is that what it's called? It's called
Ooh,
The Woman's Encyclopedia of Myths and Secrets.
I
And I
love
quote
that.
this on my website, but it's cunt is an actual word, right? It's a curse word, right? Primarily in the United States, we use it as like a horrible derogatory thing that you call typically a woman, but also you would call like anyone and just be like, wow, you're the worst of the worst. And we love to make swear words that are about genitalia, right? Like that's our favorite go-to. And usually if we're talking about the male genitalia, it's like, wow, they really suck, right? So like, I mean, asshole. We're just starting with like a lot of swearing, guys.
I know, right off the
But
bat, I
if
love it.
if you call someone a dick, right, there's that. But if you call someone a cunt, it's like you're saying like, or a pussy, right? Same thing. It's like,
Mhm.
oh my God, you're just like weak and lame and terrible and bitchy and all these things, right? Like all those other words we use. Um, when in fact, the very origins of the word cunt come from like, just meaning like woman, just
Mhm.
as a reference point to a woman. And then from there, we also get other words like kin and country. They all have a similar root. There's like there's like cunny centric is a way to say something that's like woman centric, but like specifically focused on the vagina.
Mm.
It's like an all encompassing term. So it does have like an actual root as a word referring to that part of our body, not just as a curse word, but, like so many things that relate to female bodies, it does become derogatory over time because that is a classic thing we love to do because misogyny.
Yep.
So I mostly think it's funny. I don't have a strong association with that word. I know a lot of people do, so I definitely
Mhm.
understand that when someone's like, "Well, I think it's offensive." I'm like, "That's fine."
That's
That's
something
I
to look
totally
at.
get that. Totally get it. Totally get it. We're doing something different over here. And I find that most people, especially the people I'm trying to reach, who are, typically people in their like 20s, 30s, maybe 40s, find it to be kind of funny. And at the very least, it's like attention grabbing. And they're like, oh my God, like that's really what? Like that's it. And that's kind of the point. It's just to say, like, hey, we're gonna go there. We're gonna start there and then we can go from wherever you want. So yeah, it's a confronting name, but it's fun. It's not supposed to be like antagonistic or anything like that. It's just like, yes, this is a taboo area we're gonna be talking about. The whole nature of all this is really taboo. I'm gonna let you know we're gonna go there right up top. Um,
Yes. I
yeah,
freaking, I mean, I love it. I was so drawn to the name right off the bat. Like, okay, we're each other's people. And
yeah,
then, of course, like the branding, everything about your offerings, everything about what you do, it feels accessible and light and fun and playful. And on the other side of that, dark, funny, humorous, because it does have all this dark history to it, of course, right? Like you
yeah,
said or mentioned. But it feels like ownership. It feels like reclamation and power. And I feel like that's what you're teaching women these days. Um, So why don't we kind of get started in that kind of realm? Because I mean, I'm a huge fan of cycle tracking and cycle syncing, honestly, too. I don't know if you do anything of that, but I think fertility awareness method was such a mind-blowing thing for someone who maybe was raised without any kind of education about how to look and understand your body, look at your body and understand it. And also just from someone who is on and off different kinds of birth control over the course of 10 years, like who my age wasn't really. Unless you grew up with parents who were really, forthcoming with information, or you were in a really maybe liberal school or something like that. But
Yeah.
yeah, I mean, I'm curious too about your start in it all as well, and yeah, just your journey with it.
Yeah, yeah. So, I mean, I am one of those odd people. I think that like my mother was so anti the pill. So I didn't go on. I desperately wanted to go on it as soon as possible. I was like, can I please like not get pregnant and get boobs? I would love that. Did not get pregnant, did not get boobs, but I did eventually go on it at 18 for a few years. So I was on the pill. I've done a few different birth control types. I was on the pill for probably on and off for about like 5 or 6 years. And then I did copper IUD. Along the way, I also tried a diaphragm. I used condoms. I've used withdrawal. And now at this point in my life, I use a combination of like fertility awareness condoms and withdrawal. And so I use all those things for my own ends.
Yeah,
Yeah,
I feel like the two of us combined have probably tried it all, minus maybe
probably.
the matchstick. But yeah, I did NuvaRing after the pill, and then I did the patch.
There you go. Yeah. So like that's pretty much all the options.
Yeah.
Yeah, and I think they all have a place and a role. And I really like changed my mind. I think like coming from being very pro pill and then being kind of anti pill and just like using that as a catch-all for all hormonal birth control. And especially at this point in my life, being like, we got to use whatever works for you. Know about like what the side effects could be or the risks are, know what to look out for, and use what's best for you, especially at this point in time in the United States where abortion access is being actively overturned every day. Having very reliable methods of birth control is really important. And you shouldn't be scared into using a contraceptive either way. So, people being scared into using hormonal birth control and people being scared out of using hormonal birth control. I don't think either of those are good approaches. I don't think we should, continue to just scare women about their bodies.
Mm.
But, giving us accurate information and helping us make the best decision for us is what I think is the most helpful. But yeah, so I have always been interested in the menstrual cycle from a young age. Don't ask me why exactly. It wasn't like my mom was like super into all this stuff. She went into menopause super early. So by the time I had a period, she'd had not had a period for a very long time.
Mm.
Um, but I read the book, The Red Tent at a young age. I was at a religious school and I was like, this is allowed because it's about the Bible, but it's like,
Yeah,
have you ever read that book?
I have, yes, in my 20s.
So good. Yeah, it's sexy. I read it at like 12. Um, or 11, something very young.
I love it.
And it really shaped like a lot of who I am as a person, I'm not gonna lie.
That's
Um,
awesome.
yeah, and so just being really interested in sex and birth control and not wanting to get pregnant, even though I wasn't really sexually active in a way that could have resulted in pregnancy until I was 18.
Mm.
But really interested in those topics. And I wanted to do something in health, but I didn't really know what that would be. And I didn't think I could be a doctor for a lot of reasons. But then in my 20s, I came off hormonal birth control. I didn't want to get pregnant, but I just was like exploring a bunch of like witchy woo-woo shit. And I was like, what
Love
does my
that.
body in the moon do? Like, what happens with me in the moon?
Mm.
Um, and so I really was just like, I know that the pill is suppressing parts of my cycle. I'm just curious what's happening underneath there, but I don't want to get pregnant. And that led me to the book Taking Charge of Your Fertility, which, yeah, it's on your shelf right there. And just like opened up a whole new world of being like, hey, you thought you knew stuff about your reproductive system. Turns out there's a lot more that you don't know, but you could know. And in fact, we have lots of information on, but for some reason, we don't tell people about it. And so from there, I learned about fertility awareness. I tried fertility awareness. I was like, ooh, I'm scared. I'm going to go on the copper IUD. Ooh, I
Mm.
actually want to become a fertility awareness educator. I guess I have to like walk my talk. And so over the course of like a few years, I became a Justice method fertility awareness educator. So I graduated from Justice College in 2019. So I'm a holistic reproductive health practitioner and certified fertility awareness educator in that specific method. So those are like my specific credentials. But this all just came from a desire to learn more about my body and how it functions, and especially like parts of it that I found really fascinating that I wasn't given enough information about. And now I just go around telling people about it.
Hell yeah. Hell yeah. I mean, as soon as I learned about the phases of my menstrual cycle, I was like, well, let me just tell everyone and mention it to anyone who will listen. I'm so curious though, since you've had so much experience going in and out of all these different methods, could you notice those big changes or any little changes? Like what did you feel like was maybe the most fascinating thing that you experienced or that you've noticed over the years, even in your clients?
Yeah, I mean, personally, I think I was always someone who did well on hormonal birth control. Like I'm a good pill taker, like it's part of my routine. So
And
I
was
didn't have
your
any like, yeah.
Was your period normal regardless? Like when you were not on any kind of birth control?
Yeah, so I never had really problematic cycles. They've always been pretty normal. And so going on it, I can't, it's hard to say. Like I've thought about this a lot. And
Mm.
then the time in like my late teens, early 20s was pretty, tumultuous as it is for lots of people, just like transitioning to college and, growing up and all those things. So if I did have any negative side effects, especially emotionally, it's hard to tease it out,
Mm.
which probably would have been like the most obvious one for me. I
Mm.
do remember coming off the pill one time, and I like almost blacked out. Like I had this very strange reaction.
Mm.
It could have been for a myriad of reasons, but I like got my period and I got like very lightheaded and yeah, like I just remember like almost passing out entirely.
Wow.
Was very strange and it was painful and it was so weird and I really don't know why that happened. That was the weirdest thing coming off. Um, but no, like I don't think there's been any, kind of changes since then. The copper IUD, right? I had really heavy bleeds, painful periods, and kind of like I think if I come off this, I won't have those problems anymore. And it's not to say like I have perfect cycles. I definitely don't. There's like they're pretty average if you look at them, but there's always something weird happening in there. Um, you definitely don't have to have perfect cycles to teach people more about their cycles. I will tell you that. But yeah, over the years, like I think things do start to shift. And as I'm getting into my 30s, I'm definitely noticing some like shifts in my cycle that I'm a little bit every once in a while like panicking about. Because when you know too much, you're like, oh God, this could be all these things.
Totally.
And then I have to like, shepherd myself and be like, why don't you take a deep breath and like eat some more food?
Literally. I feel the same way because I've talked about it on other podcast episodes before where my period has been fairly regular, normal, you know, honestly, every 28, 29 days, it was like on the dot kind of regularity. But ever since I turned 30, it's like there's just been this shift and it's not unpredictable, but it's definitely going to come between a range of 28 days to like 31 days, 32 days, maybe. And
Yeah.
there were three bleeds now, if you include my last bleed, where the blood wasn't that bright red, that crimson cherry, whatever. And it was like a little bit more on the brown side or purple side. And I'm like, fuck, my progesterone. Am I going to be able to conceive? Like, am I going to be able to like hold a pregnancy throughout this whole entire process? I don't know. Like, that's just a big question. But then it's like, okay, hold on, take a breath. That was
Yeah.
1 month because every other time it's been perfectly red and normal and I feel good and
Yeah.
normal, you know?
Yeah, and I think expecting our bodies to be the same even cycle after cycle is a little unreasonable. I mean, it's different, right? When you've like had that history of like, okay, things have been this way for so long and now things have changed. And saying this to both me and you, it's like, okay,
Yeah,
if it's one cycle and especially if you're like there were some weird things that happened in the last couple months, it's not indicative of a problem, right? If it becomes a pattern, if you're noticing the same kind of pattern over and over, like, yeah, then we want to address that. But even then, it's hard to, it can be hard to like always know like what does exactly this mean, and what does this mean for my fertility, and what does this mean for my future. And we don't always have the full answer to that. And I've certainly seen people, especially in the conception question, right? I've seen people conceive with cycles where I was like, okay, there is like some weird stuff happening here, and just
Mm.
being like luteal phase too short, or you're not really seeing a lot of cervical mucus, or we're getting closer to understanding when you're ovulating. It seems like you're having sex at the right times, all those things. And it happens. People get pregnant in cycles where you're like, wow, I did not think that would happen. And people don't get pregnant in cycles where you're like, everything looks totally good. Um, and so it is a little bit of a mystery. But yeah, trying to pay attention to our body, like say, okay, something is different. What do I need?
Yeah, yeah. I mean, that's the all-time question, right? Because our bodies are changing all the time. And something that I love about what you offer is that it can serve you at all these different phases of your life. I mean, maybe you can list that off for people so that they kind of get the breadth of how impactful this can really be.
Yeah. So, fertility awareness is simply just based on observing your bodily signs, right? The method I teach is based on cervical mucus. Cervical mucus tells us that ovulation is approaching, and basal body temperature. Basal body temperature tells us ovulation has happened. Like very much a simplification, but that's kind of boiling it down to its parts. And so that information can really help you like navigate different times of your life. So, for example, if you're heterosexual or if you're having sex that could lead to a pregnancy, especially in your earlier years. I'm going to say 20s. I don't know. Like teenagers can definitely track their cycles. Should they be using it as their primary form of birth control? I don't think so. But it's
Right.
good information to have, right? We can always combine these methods too with other things, right? Like condoms or withdrawal or diaphragms or cervical caps or whatever, if you want to go those routes. But especially if you're doing withdrawal, you gotta really, your partner has to be trustworthy and good at what they're doing. But
Yeah.
just saying, like, as an example, you could use fertility awareness in your younger years, or you're not trying to have babies this time of life. Use it as a way to avoid pregnancy. Okay, I'm gonna note what's happening in my cycles. I'm gonna make sexual decisions that support my goal of not getting pregnant. You can also monitor the health of your cycle. That's something we can always do throughout our lives. But if you have like really strange symptoms, or if you're noticing like you have really bad PMS, or if you have really heavy painful periods, or if your cycles are irregular, these are all really important things that tell us about our overall health. So, in our like let's just say 20s as an example, using it as both a way to like help you make better informed decisions to avoid pregnancy, also to say like if you have an oops, you'll know better when to take emergency contraception. So, it just
Mm.
gives you a greater level of understanding from that way. It helps inform, what's going on with your health. If you're skipping periods, if you're like having really irregular cycles, that could be a myriad of things. That could be something like polycystic ovarian syndrome, PCOS. It could be, again, that you're too stressed, that you're not eating correctly, all these different things. So, knowing that in your 20s is great information. A lot of people these days tend to start to think about getting pregnant in their like late 20s or 30s. I'd say like most of the women I'm working with are in their 30s trying to get pregnant for the first time.
Mm.
As we enter in that decade of life, everyone's going to start telling you its clock is ticking. You got to make a baby now. If you understand what's happening in your cycle, it gives you a little bit more flexibility. So you can say, like, okay, like I'm still ovulating. I'm having regular cycles. Some things are weird every once in a while, but mostly things are progressing. Great. I can use this information when I'm ready to get pregnant. Then, when you're, either doing like insemination or, doing the old fashioned way of getting pregnant, you can time it really accurately. And you can say, okay, we know we're trying at the right time. We know things are unfolding as they should in my cycle. If you don't get pregnant within those, like, I would say, especially if you're tracking it, if you're not pregnant in those first like 6 to 8 months, definitely go see your doctor. It gives you a heads up if there's something else going on instead of waiting maybe a whole year and just kind of floundering around.
Mm.
And then you can track the return of your cycle post pregnancy. You can look at, like, okay, getting a heads up on ovulation coming, getting that first period. It can be really rocky time after postpartum. So, different things there. As we continue to age and go into perimenopause, you can start to understand what's happening with your cycle there. What phases are lengthening? What's shortening? Are you ovulating? That can help inform like other ways to take care of yourself.
Mm.
And then going into menopause. And once we kind of hit menopause, right, we're kind of over with all of these things, but you can start to use it as a health tool. You can still use it, especially like in perimenopause one of the things that start to happen is because the brain and ovary communication is breaking down, you might ovulate way earlier than you usually do or way later. So at a very different time than you have been. You might ovulate more than one egg at a time, which you can't really tell from charting, but you can understand when you're ovulating. And something that happens is people get pregnant unexpectedly in their 40s sometimes because their practices that they were doing their whole lives stop working because their cycles change. So these are all just like, I don't like off the top of my head, those are some examples that you could use throughout your life with fertility awareness.
I think that's a perfect explanation of everything. And I can almost visually see one person, maybe even visualize myself walking through all those stages. And it's like, yeah, 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 that could help. That could help. Yeah, yeah. Yeah. And that's like how I've used it and how I will continue to use it in my personal practice. But I love that. I'm curious, just from like your client stories, maybe if you have any to share, I'm curious how many come to you having this problem of maybe, unexplained infertility or something like that. And maybe they do know a little bit about their cycle and maybe they don't. But like, I almost want to know if there's a percentage of how many people just don't know when they actually ovulate and when to time that with the sex that they're having to get pregnant.
Yeah. Yeah, so I can't give you an exact percentage, but I'd say
Sure.
it's probably it's a good chunk of the people I see. I've been trying to get pregnant. I'd say I see people kind of at all different stages. So people who are like, I am trying to get pregnant this year, to people who are like, we have been trying to get pregnant for the last 3 years.
Mm,
And so different things happen. But a lot of people just go off an app, right? Like they're like, okay, I'm going to download this period tracker app and it tells me when I'm ovulating. So we're just going to have sex in this window. And then they don't get pregnant. And then they start to freak out around like month 3 or 4 of trying that there's something wrong.
mm,
And then, oftentimes I'll talk to people at that point and be like, well, there's a good chance that you're landing in that window, but you might not be. So let's like look at some deeper things there. So it is a pretty significant population, I'd say, that doesn't really understand when they're ovulating, because our education around it is so poor.
mhm,
And because we go into it with this assumption that like you have to be super careful to not get pregnant unexpectedly. So therefore, getting pregnant must be super easy and super common. And for some people, yes, it is. Like there are people who get pregnant on like, hormonal IUDs. It is possible.
sure.
But it's also, especially as we get older, it's a little bit harder to get pregnant, versus like at 20, like 20 versus 38 are very different scenarios. And especially if you've been spending so much of your life just avoiding pregnancy, it is a bit of a mindset shift too. But
Mhm.
yeah, a lot of people don't, because we just assume that it's happening at a certain point in our cycle, and that's not necessarily the case.
Right, because like you said, in perimenopause even, that same scenario where you can ovulate earlier or ovulate later, it can happen at any time in your cycle while you're in those reproductive years, potentially, right?
Totally.
Um,
Yeah. Yeah.
Go ahead.
No, I mean, it's just to say, yeah, it's really common for me to see people who are like, I really didn't know anything that you just told me.
Mhm,
And then they find, they get pregnant. Not everybody, but a lot of people do. Um, People with PCOS, people especially with like really much longer cycles, I think are at a disadvantage because they're given this narrative that ovulation happens on day 14 and then they try up until like day 14, 15, 16, but they're not really ovulating until maybe day 30. And
mhm,
so I've worked with a lot of people in that scenario where it's like, okay, you might be ovulating. We need to figure out if you're ovulating first and foremost. That's something you can track at home. And then, we figure that out and you can still use that information. And then we can figure out, why is your cycle so long and what can we do to support it in coming back into like more normal parameters.
yeah,
I've also seen a lot of people, especially recently, I've seen a lot of people who are ovulating, but they're ovulating and then their luteal phase, the phase after ovulation, is potentially too short to support implantation. So I see that probably more frequently than people who aren't ovulating entirely. But that can be an issue too, especially like immediately stopping hormonal birth control.
mm. What would you say is like a too short luteal and what feels more like a normal range?
Yeah, so the normal range, what's considered a normal range for a luteal phase, is between 10 and 16 days. So this is like from the day after ovulation is when we start counting that.
Mhm,
Um, So the assumption is that most people have a 14-day luteal phase. That's more common. That's like the average. I'd say on average, it's somewhere like 12, 13, 14 days. And it should be pretty stable.
Hmm.
But anything less than 10 days consistently is considered luteal phase deficiency syndrome. Like it has a name. And what that means, or what it could mean, is that you're just not producing enough progesterone post ovulation to sustain the lining of the uterus. Why that matters is once fertilization happens, that little fertilized egg still has to work its way down the fallopian tube, get into the uterus, and then implant. And the uterus doesn't make it super easy for implantation to happen either. Like that fertilized little like embryo has to work really hard to implant.
Like bury
So
itself in.
has to really get in there. And that process from fertilization in the fallopian tube all the way to implantation in the uterus, and like huge uterus, but it's not that far, but it does take time. It can take up to 10 days. It can take like 7 days, but up to 10 is possible.
Mm.
So if by the time it gets there and it's starting to implant, we're starting to shed the lining or the lining is starting to break down in anticipation of menstruation, then you're going to have problems like getting pregnant and you might have problems staying pregnant. So if someone is noticing, like, let's say you're using like an ovulation test and you're seeing like a positive ovulation test on cycle day like 20, but you have a 28-day cycle,
Mm.
that's a good indication that things are too short. You're ovulating, which is good, but we need to do something to support your progesterone production. So you can actually like stay pregnant. So if I would say like reasons to look into this would be like you're noticing that pattern in your cycles. If you're having like recurrent, especially like chemical pregnancies where you like get a positive pregnancy test, but then you get a period shortly thereafter, those sort of things. Or if you're just like, you've been trying, you think everything is going, your cycle's a normal length, you're seeing a positive LH test, but you're not getting pregnant. Those might be some things to look at. There's a lot of things there, but that might be something to explore.
And when you say look at it or explore it, what are you recommending that they do at that point? Like, would you recommend a certain testing or like, yeah, I'm curious where you point your clients to after that.
Totally, everything. So, I am not a medical provider, but I do refer people to medical providers. So, I think getting some testing is a great idea. Get some cycle day specific blood work. That usually looks like most things are tested around cycle day 3. But if we're testing for progesterone specifically, you want to wait until 7 days after you've assumed ovulation happened. So, either after a positive ovulation test, after a rise in basal body temperature. You could even use like when you've stopped seeing like clear, stretchy, slippery cervical mucus, roughly 7 days later. So you want to do that testing. I think it's a good thing to do.
Mm.
Um, Other things we'd want to look at. We'd want to look at like what are the stressors in your life, either external or internal. So, do you have a lot of work stress? Do you have a lot of interpersonal stress? Like what's your actual like felt stress level? What's your sleep like? What are you eating? Do you have a thyroid condition? Do you have some other kind of like, pre-existing condition, diagnosed or undiagnosed? Like we want to find those things out. And then like depending on what that reveals, it's like, okay, are you sleeping enough? Are you eating enough? Doing those things, like what can we do to reduce stress? This is honestly like controversial, but I've heard from like different providers different things. But in some cases, supplementing with progesterone, like doing hormonal therapy can be really helpful. The literature is a bit mixed on that. But I have talked to many providers who are like, I do recommend that to people and it does help them get pregnant.
Mm.
So even if you're not trying to get pregnant, but you're noticing your luteal phase is kind of short, maybe you're having a lot of PMS symptoms, maybe you're feeling more anxious or depressed near the start of your period, things like that. Or even like you're feeling really angry. Any of those things could be related to a progesterone deficiency.
Mm.
So you could, I think it'd also be something that you could talk to your doctor about in terms of trying progesterone therapy, but also as a holistic practitioner, like what else is happening in your life? Because yes, we can like sometimes we need to bring in like the bigger guns, right? The
Sure.
hormonal replacement therapy, all those things. But if fundamentally you're not sleeping enough, or you're not eating enough, or you're eating a lot of inflammatory foods, and you're not getting like the right things that you need, you can't out supplement like a bad lifestyle.
Mm.
And so what can we do to support your overall physiology? Because it's your body just saying like we don't have enough. to do ovulation and then pregnancy, because that's a really big deal for us. And we want to survive first and foremost.
Mm-hmm. Mm-hmm. I always say, I mean, you know the book, The Fifth Vital Sign, but it
Yeah.
is to me like any kind of reproductive or any kind of menstrual or any kind of pelvic floor, any vaginal symptom, like all of that is just like a hey, we need some support. And it usually is some of these like fundamental things that we can look at that are they're simple, but maybe not easy to
Oh, yeah.
address, of course. But
Yeah. I'm always saying to people, like, I'm going to tell you, you should work on your stress. And I know that's really easy for me to say and really hard for you to do. So you can like be mad at me. But unfortunately, like that is part of it. And one of the ways that we can see that in our cycle too, going back to the luteal phase and progesterone, is if we are going through an acutely stressful time or if we are living with chronic stress, that means our body is producing more cortisol to support us through that, right? Like this is how we manage that. But one of the hormones that goes on to make cortisol also can go on to make progesterone. So if we don't have if we have a lot of stress, we will not put resources to progesterone. We put more resources towards cortisol so
Mhm.
we can survive. So you're literally making less progesterone in order to cope with the stress. And again, that's an oversimplification, but that does happen inside the body. So when I see a really short luteal phase, I'm like, what's going on here? Again, the other thing I will say too is like if you were just coming off hormonal birth control and you're tracking ovulation signs and you're tracking basal body temperature, and you notice your luteal phase is really short, don't panic. Continue to like, I would take care of yourself. And with time, you should notice your luteal phase lengthen. But I see that a lot with like post hormonal birth control cycles, just like short
Mm.
luteal phases that then adjust over time without like having to do anything like too crazy.
And do you see that that shift depends on how long they've been on hormonal birth control and like how long is that range that you've seen
It's a good
of it
question.
shifting?
Um, Sometimes it is kind of all over the place. Like I've definitely
Yeah.
seen people who have been on it for just a few years and noticing that, people who've been on it for a really long time, like, 10 plus years and noticing that. I've also seen people come off hormonal birth control and have perfectly normal cycles like immediately.
Dude, that
Um,
was my story,
yeah.
but I
Yeah.
do attribute it to the fact that I did cycle syncing through Women Code
Yeah.
for 2 months prior to coming off of it, which was even an accidental. I wanted to cycle sync a little bit more, but my insurance wasn't going to be paying for my patch or something like that. And I'm like, it's $127 for these stupid little
Oh
patches.
yeah.
Like, what the hell?
Yeah.
No thanks.
Yeah.
But
Yeah. So it totally could have been part of it. Yeah.
yeah. Oh, that's so funny. I'm curious too if like, I mean, because tracking, I know I get a lot of when I recommend it to people too, like, hey, have you taken a look at this? Like if they're using an app or they're using like the Aura Ring, or maybe they're still like paper charting or they want a paper chart instead. I get some pushback because it is kind of also another added thing. It's another maybe even stressor in their life, right? To have to take a look at this every single day. I'm curious what you would say to someone who puts that argument back at you.
Totally. I mean, I think it depends on what they're trying to do. And I
Yeah.
do think I really try to meet people where they're at.
Mhm.
Um, you know, we do have a lot of like more like useful femtech things that can help with this. So I think there is a lot of knowledge and power to be gleaned from like actually looking at your bodily fluids and stretching them between your fingers, but not everyone wants to start there, or it seems like really daunting. So you could simply start with just tracking the first day of your period. If you just like, if you're not ready to fully commit to this, but you're a little bit curious, but this is too overwhelming, start with just tracking the first day of your period. So many people don't do even that. You could just start there, like get a period tracker app, put it on a calendar, write it on, and wherever you want to put it. It doesn't have to be anything in particular, but tracker apps can be really helpful for that. And just track that and then see how that goes. You could also do like kind of self check-ins, like saying like, oh, how do I feel today? Do I notice like what do I generally feel on my period? And then like after my period ends, how do I kind of feel? And then does that shift throughout the course of these days? So you can do it from a more like light touch perspective
Mhm.
if you're just curious. If you have a very specific goal, if your goal is, I do not want to get pregnant, or your goal is, I do want to get pregnant, you do have to devote a little bit more time to this, especially in the contraceptive category. So again, condoms work really well. You can certainly use condoms. Withdrawal can also be effective, right? Like all these things if done correctly. Um, so if you're still like, I don't know, I'm feeling kind of freaked out and overwhelmed, one, I would work with someone. Like I would say, like get some support. But you could do something like Natural Cycles, right? So Natural Cycles is an app that's based on basal body temping, and it does pair with the Aura Ring. That's a really easy entry level point, I think, for a lot of people. It's not cheap. You do have to pay for the subscription to the app and you have to pay for the ring. So there's a cost associated with it, but it takes your temperature for you. And then you can start to like understand like that pattern. If you're just like, I am curious, but I don't want to think about it, that might be a good place to start.
Mhm.
But if you want to use this for contraception, but you're also like, I don't want to really pay close attention to this, then I would say please don't use this for contraception. Please find something else to use because I think you're just going to put yourself in a bad situation. Yeah.
Agreed. Agreed. That was such a thoughtful answer. Thank you so much for that. I want to pivot a little bit because we have
Yeah.
just maybe 15, 20 minutes left. I'm curious about this aspect of your work where you are helping women on in a full spectrum way as a doula for abortion or any kind of loss. Do you want to talk a little bit about that? How'd you get into that?
Yeah, so abortion is very near and dear to my heart. I've never had an abortion, but I feel really strongly that people should have abortions when they want them and need them. I do believe that I am here as a person because my mother had that option, right?
Mhm.
So I think it's really, really important. Obviously, I think that's an obvious statement. I know a lot of people might not agree with that, but I think abortion is a key piece of our reproductive health care. And we've been doing abortions forever. Human beings have always been doing, like, figuring out ways to end pregnancies. And if we couldn't end the pregnancy, then we did a lot of infanticide. So I don't think
Mhm.
we should be doing infanticide. I think that's very bad. I think abortion is the much obviously better option there. But that's like in a historical context. Um, but I think just for me, again, kind of going back to our conversation at the top, like taboo subjects, it's always called to me because I think it's an underserved area of our lives. And it is still, even today, it's becoming more like literally criminalized. But let's say, like, let's rewind like 5 years ago. Even then, abortion was still stigmatized. Like we could say lots of people are doing all kinds of wonderful, wonderful work around talking about abortion. It's still pretty stigmatized.
Mhm.
And it is just a potential outcome. A pregnancy is a potential outcome of having sex that can lead to a pregnancy. It doesn't mean you're trying to get pregnant. Um, but if that happens, I don't think every pregnancy that develops is meant to continue on. And I think that is between the person with the uterus and whatever other people they want to involve with that. But it really is like you have the uterus, you make the decisions. So just like supporting people. I mean, really, all of my work is about supporting the people who have the uterus. And just like there is so much need there. And it can be grief, it can also be relief, it can be all those things at once. Um, I think having children is a really big deal, and we should have the children we want to be having as much as possible. So I don't see this in any way like contraindicating anything else. I think there are so many fertility workers, so many people who work in women's reproductive care, people who work like in fertility specifically, who also have worked in abortion care because they are just like different sides of the coin. And so that
Mhm.
could be like an elective abortion, and it could also be like there's something wrong with this pregnancy, and our best option here is to just end it now, either for your safety or for your future fertility or for your mental health. Like there's all these different reasons that abortion is so necessary. And yeah, just really like that idea of like providing support where there is a lack of support is really important to me. And
Yeah.
also being a place where people can just talk about things, or like maybe you have complicated feelings on it. Some people find it to be complicated and some people find it less complicated.
Mm.
Um, but I think it's just intrinsic. Like if we are going to exist on this planet, it is a key piece of how we care for ourselves.
Mm-hmm, mm-hmm. I feel like something that they say in birth work in general, right? Which I feel like fertility awareness method, knowing about your menstrual cycle, um, and abortion care, all of this is like it is the same coin. It's like
Yeah.
birth work is death work, essentially. It exists all in the same realm, all in the same room
Yeah.
sometimes. So I think that's really powerful. And I feel like, well, it's like with fertility awareness method, that's almost like getting to the root of potentially avoiding any kind of abortion if you never wanted to have one, right?
Yeah.
But yeah, people are still having them, and it is a huge access point, and it is very nuanced. So I don't want to like gloss over that, you know.
No, I think it's a deeply gray area, honestly. Like
Totally.
I feel very confident in my stance on abortion and that it is necessary, and I would go so far as to call myself like pro-abortion. I am also pro people having children. It's not one or the other, it's
Right.
both.
Right.
Um, but it is very gray and nuanced, and people feel all kinds of different ways about it. And I am completely fine with someone who's like, I would never have an abortion, and I honestly don't think anyone should have an abortion. That's fine.
Mhm.
Just don't make laws about it. Like then you're enforcing your opinion on other people, but you can feel that way. And if you want to put your efforts into supporting people having children from unexpected or unplanned pregnancies, like great, that's good. Like let's do that. But you can't like force your opinion and your feelings on other people. Like that's really unconscionable, and I think anti-family, anti-woman, anti-feminist, anti-people with a uterus. Like it's just it is I feel like it's honestly anti-life in a lot of ways, even though,
Mm.
we have that pro-life side, but
No,
I don't
it's
think yeah.
so true.
Yeah, and I think also as a fertility awareness educator, because there is this idea of us being anti-abortion, right? Like we have the whole trad wife movement, which again, like
Mm.
God bless, do what you want. But there is this idea out there that the only people who are fans of fertility awareness are secretly forced birthers and want people to just like have pregnancies and like be
Hmm.
stuck there. And
Interesting. I've
that
never seen that. I've never felt that. But of course, I'm not a fertility awareness method teacher or educator.
that's how, yeah, and that's not how I was trained in any way. Like the people I hang out with, the people I trained with, it was all very much like, yeah, like, do it, use an abortion. If you need abortion, go for abortion. Here's ways to like access abortion, like all this, like, that is the water I was, drank all the time, was just like very much like a pro reproductive justice stance, a pro abortion stance, all these things, pro choice, however you want to say it.
Yeah.
Um, but there is an idea, and a lot of times when people write about fertility awareness, they're like, well, people who use it just end up pregnant. And some people do, but people using again, having tubal ligation sometimes end up pregnant. Like it is possible. So what do you do
Things
in those cases?
exactly. Things are reversible, you know? It's so true.
Yeah.
Yes, yes, yes. The outcome could always there's always a chance of pregnancy. Like
Yeah. So what are you going to do? How are you going to navigate this? I mean, I think vasectomy is an excellent idea. I think we should
but
have more vasectomies, but then
I've
that's a
heard of
pretty
that getting
that
reversed.
can, yes, that can, like, sometimes that doesn't work. But it's also like a pretty permanent method of birth control. So
Right.
yeah, I think it would be great if we have more future technology that like prevents sperm from getting into ejaculate. Like that is really, I mean, if we want to go if we're talking about the root of the issue is ejaculation. Like
Right.
that's
There's have you read or heard of that book that's called Ejaculate Responsibly?
yes. Yeah, yeah,
Did you
yeah.
read it? I don't know. I didn't read it. But that's so funny that you mentioned that.
Yeah,
Yes.
there's like I don't know if I know I haven't read it, but there was like another opinion piece or this like written by this woman who's a Mormon mother of six, and she was
Oh.
like, I don't know if she's the same person who wrote the book, to be honest with you. Someone can check us, but her whole thing was like, yeah, the what causes unwanted, unplanned pregnancies is irresponsible ejaculation. Like that's it. If you have a vagina and a uterus, you can orgasm and nobody's going to get pregnant. If you have a penis and you
Mm.
orgasm, someone might get pregnant. So not that like, people are doing their best. I don't think it's just like everyone is running around being irresponsible with their ejaculate, but some people are,
Hmm.
and there are real consequences to that. So
Right.
again, if we're doing root cause medicine, if we're doing root cause stuff, the root cause is sperm. If you have a penis and you have testicles, you are fertile every single day until death after puberty. If you have a uterus and ovaries, you are fertile like maybe a week, maybe for like maybe 40 years.
Right. Right. But that's like, I mean, the male birth control question too is so sus because even then they don't want to take, do we trust them to be responsible for taking a pill every single day? Some of them are, and some
Some
of
of
them
them are.
aren't. And some
Well,
of
I
them
think
don't want to tolerate the side effects that we experience too, you know, if we
totally.
were on it.
Well, and again, in that same piece, which I should find and link to you, she
Yes,
talks
please
about
do.
like using a condom to have sex is kind of like using a fork to eat ice cream. It's like it's a little less ideal, like it's a little bit harder, but like you still get the ice cream in your mouth. You're still having ice cream. It's just like maybe not your preferred tool.
Right.
And it's like condoms do work. They do work, especially if you don't want to get pregnant. Condoms are great ideas. And I would also say, like, if you cannot trust, like going back to even fertility awareness for contraception, if you cannot trust your partner to be responsible with their ejaculate, maybe they're not the right person to be having sex with in the first place.
Mic drop. Yeah.
Or you need to manage very carefully what kind of sex you're having with them and when, if you do really, because look, we've all been there where we're like, I should not be doing X, Y, and Z with this person, but I cannot help myself. So no judgment, but also like take a moment and be
Yeah.
like, what are we doing here?
Yeah.
What is it that you want? Yeah.
Absolutely. I feel like a really hot topic for between myself and my partner right now, just in general, not just in like contraception or anything like that. It's self-responsibility. And it
Yeah.
comes with both partners or whoever's involved in the situation, right? Um yeah, self-responsibility. How can you be responsible for your own functions and your own bodily things and your desires?
Yeah. And again, that's fertility awareness is especially when we're using it from a contraceptive perspective. But anyway, it is a radical self-responsible act to like pay this close attention, right? So like even that question of like, I don't want to do this. You certainly don't have to. We live in a time and place where, for now at least, and I hope it remains this way, we have really reliable other ways to avoid pregnancy. It is a different choice. It is a different orientation to your body and an orientation to your fertility and your menstrual cycle and everything below the waist to say, I am going to pay attention to this every single day. And I'm going to look at my toilet paper and I'm going to touch whatever is there. I'm going to take my temperature and I'm going to look at that and I'm going to use that to guide my decision making process around how I care for myself, how I have sex, how I build my schedule, like any of those things is a very different way of orientating to our bodies. Yeah.
It's cunt centered.
It's cunny centric.
I love it. I love it. Oh my gosh, Manna, you were just so knowledgeable. I could talk to you all day, honestly. I feel like, well, about all other subjects too. And maybe we should just do a part
We
two
should, yeah.
one of these days. Season 3, come back. But where can people find you? How are you working with people primarily right now? Or how do you want to be working with people primarily right now? Yeah, give us a dish.
Yeah, so I have a social media presence that's always very spotty, but I'm usually on there at the Cuntsultant, but cunt is spelled with a V, so it looks like the Cuntsultant. It like looks very Yiddish on Instagram. You can also find me at my website, which is thecuntsultant.com. You can email me. I primarily work with people one-on-one, although I'm working on some more group offerings. So you can stop by for a consultation on anything that your vagina needs. That can look like fertility support. That can look like let's go through your birth control options. Let's talk about, coming off the pill or going on the pill, or let's talk about abortion or just that weird thing that keeps happening in your cycle that no one can tell you what it's about. Maybe we can figure it out together. And if not, I'm really happy to give you referrals to other people. I think that could be really helpful. And I also teach people fertility awareness on a 6-month basis. So it's like a longer term working relationship. So we can really get into your cycle and help you understand what you're seeing. And yeah, those are the main ways. So you can find me on my website, on Instagram, and then I am also a provider on Maven Clinic. So if you have Maven Clinic as a benefit through your work or your insurance, you can find me over there too.
Incredible. I've never heard of Maven Clinic. What is that?
Maven is super cool. It's all telehealth, and they
Oh.
focus primarily on women and family health. So they actually hire fertility awareness educators. So you might have it as a benefit, like especially like check your insurance, like check your wellness benefits, check with HR, see if you have it, and then you have access for free included in your benefits to people like me, people, OBGYNs, naturopaths, nutritionists, career coaches, mental health providers, pediatric care, all kinds of different providers on demand. It's really awesome.
Wow, that's incredible.
Yeah.
Well, yay. Thank you so much for being here and for sharing everything. I'm so
Yeah.
excited to have people listen to this.
Thank you so much for having me. And I love that we're both in San Diego.
I know, right? Woo woo. Just so
Yeah.
you know,
Yeah.
she's local. She's a
Yeah.
local
We're all
babe.
local. Yeah. Thank you so much.
Thank you. See you guys next time.